It's like a tidal wave some days in the office. We'll just be riding that tidal wave, and the demand for these medications, because they see their neighbor has significant weight loss and significant health benefits, they want to be part of that. So can you speak, like sometimes over the course of the day in our practices, Nick, I see a lot of clinical challenges, not just with obtaining the medication. And I think that's a topic that we're all pretty familiar with and how we maybe try to negotiate that. But can you talk about some of the clinical challenges when maybe a patient is able to obtain that medicine, setting expectations and setting some parameters for them as they go and their journey early on, at least?
Well, I think that's a pretty broad topic because one, we have the challenge of patients getting it on their own. So you may not even know the patient is taking the medication, or, they may have started it weeks before they came to see you. And so that I think is a challenge in of itself. And I think because the medications are so readily available, patients don't always understand the importance of the other components of managing weight when you're taking these medications because they're so potent. They can decrease your appetite. And there's a real paradigm shift. In the treatment of obesity, we were always talking about how to cut your calories and eat less and exercise more and try to create that negative energy balance. Well, now all of a sudden we have these high potency medications that are suppressing appetite. And now I'm spending as much time making sure my patients are eating enough, that they're eating the right things, that they're doing the right things. And so it's not just writing a prescription. It's not just prescribing a medication. It's really incorporating the medication in a bigger picture of patient care so that the medications, in my mind, are really there just to help the patient make the lifestyle changes they need to make. They're not a weight loss treatment by themselves.